Make the sequencing decisions based on a number of factors. They include what line of therapy we're referring to in the first place, but also the patient's characteristics, the burden of disease, their symptoms, their performance status. So something that we focused on in the talk today was, many of these studies that are selecting patients based on a given biomarker that requires central confirmation of this biomarker, it takes several weeks to get that answer for these patients in the first line, second line, third line setting. And so you are already imposing a selection bias by having patients waiting for several weeks, sometimes 3, 4, 5 weeks before you can start treatment. So patients on these studies are not necessarily representing the full body of patients that we see. And in fact, the patients that are needing therapy almost immediately in any line of therapy are better served with getting chemotherapy first. We've seen this over and over again where this is the yin in those plots where you see these patients aren't doing well at the beginning. It's because the immunotherapy is not enough to rescue them. And so these are things that help us to sequence the immunotherapy and to optimize every individual patient based on what they're doing, what their characteristics are, what the biology of their tumors are. So for example, if they're MSI high, these are the patients that we want to move the treatment with immunotherapy as early as possible, as soon as possible, because the benefits are large and we don't want to miss the chance of not being able to get it to them because they progress rapidly on first or second line treatment.